I would like you to join me in this challenge as to why kidney disease seems to be on the rise in the young. And this is something that I don't think many people are aware of, even. And truthfully, until I did the research today, I myself have only come across this important point. A lot of younger people are getting kidney disease decades earlier. Nobody's quite aware. They're probably seeing it, but they're thinking it's anecdotal. What I've done is I've taken 186 million data points, looking through the UK hospital admission data. This is publicly available information, but I understand the system, and so I've crunched it all together to try and make sense of it. And literally, this is what it's showing, and this is pretty serious stuff. When we look at kidney disease, and this will be available on the dashboard, the standout here is in the 30 to 44 years old, a 158% increase in kidney disease. And in the older cohort, it's drug induced. But these two must be connected because the younger cohorts are not necessarily on any medication. So, whatever mechanism is occurring, it is likely to be relevant to them. So, what I'm reminding you of straight away is in the description COVID's hidden trigger, why kidneys are failing, especially in younger cohorts. And what you'll be able to look at when you join me there, this is there are also free tickets and donation tickets. So come along, let us analyze this. I'm trying to do this in a very tight time frame. So in the next few days, that's just in this Thursday, the 21st of May, I'll be taking that on. I'll be looking most likely at three primary drivers: what it means, why it's occurring, and critically, when we have an overlap, what do those patients look like? This is a sequence of presentations that I've been doing, looking at multiple cohorts. And so, what I'd advise people, if you want to keep up with this, what I've put together is a whole dashboard of patterns, post pandemic hospital admission trajectory analysis, 186 million data points, looking at multiple conditions across multiple things. And in there, there's a full cohort dashboard, the methodology, the breakdown, even in terms of vaccinated, unvaccinated mortality up to May 2022, cardiovascular insights, neurological insights, toxic liver disease insights, immune privilege dashboard, and soon to come, kidney disease. This is going to be a most comprehensive dashboard. And if you're interested, the link also is there for this. But the first priority is to join in terms of trying to understand what really is going on. Now, one of the important things when you look at the data, and I've got some images here, and this is going to be in the full dashboard, but when you look at the trajectory here, we are seeing that the thing that is falling here is renal colic. This is in gray, dotted line, and it's going down. So this indicates it's not just people who are, it's not just a coding issue. But what we can see up here rising significantly in purple is renal tubular interstitial disease. And following along with it is glomerular disease. These two are rising significantly across all age groups. But as I said, the age group that seems to be most affected is the 30 to 44 in terms of the speed of the rise. Something is going on. And one of the problems is that I'm not sure how many people are aware of this. So if you are one of the few people, because many people don't see these videos, who happen to see this video, you will know something that in truth, not even doctors know. And the reason is because we don't routinely look at this data. We expect that if something like this is happening, it will be flagged to us. And you may hear about it in a conference or in a paper, but this will be years down the line. This is real world, and critically, this is occurring since the pandemic. We don't know why. And as usual, we can speculate as to what the mechanisms are, but we'll never fully know until they do a really detailed analysis about the individuals who are having this trajectory. What was their status in the pandemic? And truthfully, what I'd like to know, sometimes people focus just on vaccination status. That is absolutely critical. But I'd also like to know, one, did they have moderate to severe COVID, especially the younger ones? What other comorbidities did they have that could accelerate it? Do they have other comorbidities on top of this that are potentially contributing to their deteriorating kidney disease? Critically, do they have any ongoing symptoms since the pandemic? This is more like the long COVID trajectory, where they could be at risk for other kidney diseases because there is ongoing immune activation. And are they on medication that could exacerbate this? These are all big questions. And so, as I said, in a tight time frame, and it's simply because I've done this on multiple occasions now, looking at different trajectories, as I said, heart, brain, liver. I'm now doing kidney. And I will keep on going. And this is why I said, if you are interested before this gets fully done, this post pandemic trajectory is a very valuable piece of data. And I have delivered it in such a way that this is of value, not just to people who are in the professional research field, but for everyone. Because if you understand this, you are then able to give your loved ones, family, friends, work colleagues, information that would make them understand that this is not something that they ignore. If they are having symptoms of kidney disease, whether or not it's changes in terms of their urine patterns, whether or not it's changes in terms of their blood works, whatever it is, it does probably need to be looked at in more detail. We have a lot of work to do. There's a lot of information that has to be analyzed in order for us to get an insight into what is happening. Final point that I'll make is to do with the baseline, the percentage baseline. I'll make this a little bit bigger so that you can see it. What they looked at is in here pre-pandemic versus post-pandemic slope. And they looked at each part of the kidney picture: chronic kidney disease, glomerular diseases, and I'll go through that in the presentation, exactly which part of the kidney this is, the drug and heavy metal induced toxicity, renal tubular interstitial patterns. And so it breaks it down into all of these patterns. And in gray represents the pre-pandemic, green represents post-pandemic slope. And so what you can see is that it was rising pre-pandemic, but it has significantly increased in trajectory post-pandemic. And that is primarily for these three things: chronic kidney disease, glomerular diseases, drug and heavy metal induced toxicity. When we look at nephrotic syndrome, that's another type of kidney disease, actually that has gone down very slightly in terms of the slope. So that's not been significantly affected. But look at this one: recurrent and persistent hematuria, or blood in the urine. This has absolutely exploded in terms of the trajectory post-pandemic. Renal colic has fallen off significantly, were increased, and maybe it's because people are not passing out enough urine, so they can't make stones in their kidneys. These are all very significant patterns, and as I said, this is very valuable information. Final point, remember, coming up, the whole purpose of this is to make you aware of this presentation in the next few days. Look in the description below for the link. You can join me. There are free tickets, donation tickets, and other tickets in case you don't have it. And critically, when we look at, if you want full details about what exactly I have been doing in the past, you need to look here. And this is to do with the dashboard, looking at all kinds of dashboard patterns throughout the pandemic. And this is already available for anybody who wants it. As I said to you before, this information, very few people even know that it exists. And it's because I got tired of people telling me that my concerns were not based in data. They were just my anecdotal observations. This is what drove me to do this analysis, because I knew something was wrong, but I couldn't prove it. Now, the question is why? Nobody can tell me this is not happening. It is happening. We just can't necessarily specify why. The reason no one wants to look at it is because the implications will have to include the elephant in the room, and nobody seems to want to look back at that. And so this is why we're stuck in limbo. But at the end of the day, people are getting sick, people are dying, and we need to understand the mechanisms. No point hiding away from it. There is a responsibility to do far more research. Have a great evening. Look forward to seeing you soon.